Uterine fibroids are benign tumors of muscle tissue found in or around the uterus. Fibroids can grow as a single tumor, or there can be many that range in different sizes. Fibroids are usually confirmed during a pelvic ultrasound examination. Now, doctors may tell you that the causes of fibroids are unknown. However, race, genetics, and hormonal imbalances are major contributors and play a major role in fibroid growth. The most common symptoms include heavy prolonged bleeding, which may lead to anemia, pressure on the bladder causing urinary urgency. You may also get pelvic pain, severe cramping, constant dull aches, and shooting pains all over the body. You may get pain during intercourse, especially if the fibroids are near the cervix. Lower back pain. Fibroids can also cause compression of the colon, which can lead to a significant amount of constipation. And unfortunately, infertility and miscarriages are a common symptom of fibroid growth. The most common ways fibroids are treated by a doctor. Number one is a laparoscopic or robotic myomectomy. If the fibroids are few in number and smaller in size, your doctor may opt for a laparoscopic or robotic procedure, which uses slender instruments inserted through small incisions in your abdomen to remove the fibroids from your uterus. This procedure is less invasive, with less recovery and less healing time. Number two, abdominal myomectomy. If you have multiple large fibroids that are very deep, your doctor may opt for an open abdominal surgical procedure to remove the fibroids. Your uterus stays intact. However, scarring after the surgery can affect your future fertility. I know, I've had two. Now, a hysterectomy removes the uterus. The hysterectomy ends your ability to bear children. And if your ovaries are removed, the surgery brings you to an immediate menopause state. Over 200,000 hysterectomies are performed each year due to fibroids. So if you didn't think fibroids were a major problem, I'm here to tell you that fibroids are a major problem for women. So now that we've broken down the basics, let's get to the root cause. Surgery fixes symptoms. It does not get to the root of the problem. And that's why fibroids continuously grow back. As your certified fertility coach and board certified health coach, I look at the whole body, not just the symptoms. Two of the main hormones affecting women are estrogen and progesterone. Estrogen plays a vital role in women's health. It helps promote the development of eggs, the growth of uterine lining. It helps promote the healthy libido. It helps brain functions, and it protects the heart and cardiovascular systems, and so much more. But what happens when there's an imbalance of estrogen and progesterone? You get estrogen dominance. The root cause of fibroids is estrogen dominance. Now, what does that mean? Estrogen dominance is a hormonal imbalance. It is the overproduction of estrogen. It is the condition of increased estrogen levels relative to progesterone levels in the body. So the question is, how can you stop estrogen dominance? Your diet and lifestyle can greatly influence your estrogen levels. Let's dive deeper. Number one, stress is the body's biochemical response to life's challenges. When you are stressed out, your brain tells your body to produce extra hormones. As a result, your hormone levels rise, which stimulates fibroid growth and symptoms to flare up. Stress can cause fibroids that were once asymptomatic to grow at an alarming rate. Stress includes healing from your past childhood traumas, healing from your past toxic relationships. A lot of times we can't let go of things that hurt us. We replay it in our minds over and over again. I want you to know that your past no longer exists. Heal yourself so you can heal your body. Number two, a lot of toxins and chemicals we are exposed to on a daily basis are endocrine disruptors. They mimic estrogen in the body, causing levels to increase at a fast rate. Things like BPA in plastics, food storage containers, canned foods, thermal receipts all have high levels of BPA. hair relaxers, hair products, skincare products, fragrance candles, nail polish, makeup, non-stick coatings on cookware. They all have high-level toxins and chemicals which mimic estrogen in the body. Estrogen is like fertilizer in your body. It makes everything grow. So, number 3, the growth of fibroids depend on estrogen. Hormonal birth control, hormonal IUDs, depot shot, the patch, vaginal rings are all packed with estrogen. This creates estrogen dominance, which leads to hormonal imbalance. Refined sugary foods, carbohydrates, high sodium processed packaged foods like bacon and sausage, deli meats, donuts, sodas, ice cream, cookies, all spike blood sugar levels, which cause the body to make too much insulin. This makes a huge impact on hormonal imbalances and weight gain because fat cells trigger estrogen, which leads to fibroid growth. So what is the best diet for fibroids? A whole food, plant-based diet high in cruciferous vegetables like cauliflower, cabbage, kale, bok choy, broccoli, Brussels sprouts is all highly recommended. Now, a lot of people go vegan and get highly processed, popular toxic plant-based foods full of soy and full of chemicals. Soy contains phytoestrogens that mimic the role estrogen plays in your body. When you have a diet rich in soy products, your body's estrogen receptors are activated. So you're basically trading animal-based toxins for plant-based toxins. This completely defeats the purpose. If you can't make the commitment to do a plant-based vegan diet, your next alternative is the Mediterranean diet. The Mediterranean diet focuses on whole foods, grains, vegetables, fish, lean meats, legumes, fruit, seeds, herbs, and spices. Why do fibroids disproportionately affect Black women? Ultrasound evidence shows that more than 80% of African American women will have uterine fibroids by the age of 50. The size and growth rates of fibroids are greater for Black women than any other race. Fibroids are diagnosed at an earlier age because Black women are more symptomatic. Black women also have higher rates of hospitalization, myomectomies, and hysterectomies compared to white women. So the question is why? Why does this happen? African ancestry is considered a key risk factor for developing fibroids. Our epigenetics cause Black women to create and multiply estrogen at a higher rate. So what is epigenetics? Epigenetics is how we genetically react to estrogen, how it expresses itself in our body. Some genes are turned off in melanated people, and this is caused by environmental toxins, lifestyle, and diet. What are some natural ways to help reduce fibroids? Number 1, vitamin D may help reduce and shrink fibroids up to 32%. Make sure you have your primary care doctor check you for any deficiencies. Number 2, a high number of women who suffer with severe fibroids also have high blood pressure. So avoid added salt. Stop eating high sodium processed packaged foods. Try to lose weight, especially around your waist area. Number 3, drink green tea.